So welcome back. Now remember, diabetes is probably the oldest disease that was recorded in human history. The Egyptians recorded around 1500 BC. The doctors in ancient India recorded about the same time, around 1400 BC, and they described these patients as having honey urine because ants were attracted to it. And then the Greeks in around 250 BC name it diabetes, meaning to pass through, because they noticed that these patients urinated more. And then if you go back to ancient India in 400 AD, the doctors there started to describe different types of diabetes. Now, to better understand diabetes, the disease, what it does, how it's treated, it's important to understand a little bit about the hormone insulin. Now, insulin, the hormone, is discovered in 1921, and as we know, a hormone is just one signal made in one part of the body that's sent to another part of the body, and in this case, the insulin is made by the pancreatic cells. The pancreatic cells, when the glucose gets too high or the sugar gets too high in the blood, it makes the hormone insulin, and that insulin hormone then goes to other cells in the body and asks them to take up the extra glucose out of the blood. When this system gets overwhelmed, and then what happens is the body just starts putting that extra glucose anywhere it can. So usually the smallest blood vessels in the body and the most delicate organs, which now makes sense as far as symptoms go, right? Because if the body's glucose goes too high, the first thing it does, it tries to pee it out or it tries to urinate it out. So these patients get dehydrated, they get headaches, they get stomach cramps, they don't feel well. And then the second part is now that extra glucose is being deposited in various parts of the body. So now these patients get eye damage, they get heart damage, they get kidney damage, they get nerve damage. When it comes to the types of diabetes, type 1 is when those pancreatic cells, they get destroyed by accident by the body's own immune system. Remember how we learned when the immune system is overactive and there is no infection or cancer to clean out, instead of protecting the body, it can attack it. So in this case, the immune system mistakenly attacks the pancreatic cells. And so the body goes from having a good amount of insulin to almost nothing very quickly. And when this happens, it is called type 1 diabetes. Type 2 diabetes is a little bit different. This is when the body's system works, but it's being overwhelmed. So the insulin being produced may not be enough, or those cells, they just get tired of reacting to the insulin all the time, and they become what is called insulin resistant, meaning that even though the hormone is there, they're just not taking up the sugar that they should be taking up. As far as the treatment of diabetes goes, there are 3 important goals, and the goals can be in any order depending on where the patient is in time or how sick they are. But the first thing is to try to limit the sugar intake through diet. The second thing is to try to increase that hormone insulin. So either by giving medications to make those pancreatic cells make more insulin, or giving the hormone insulin itself. And the third thing is to try to decrease that insulin resistance of the cells in the other parts of the body so that they can react to the insulin a little bit better. And this is done through a diet, exercise, and medications. Now, as far as the long-term outlook for diabetics goes today, it is much better than before 1921, because before insulin was discovered, before we understood all the workings of diabetes, patients with diabetes, regardless of the type, didn't live very long. They lived maybe a few months to a few years. They had a lot of infections, a lot of complications like early blindness, a lot of amputations, etc. But knowing what we know today about diabetes, and knowing the importance of diet and exercise and the medications that are out there, diabetics live much longer and live much better. As Poe Dameron said, hope is not lost today. It is found. Until next time.